Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, I'd like to introduce to you my friend, Lisa Bachan. She started scanning in 1985. At that time, it was mostly on-the-job training with only a handful of schools in the U.S. that were open. Very few were accredited. She chose NYU School of Ultrasound and graduated with honors and was the president of the class. Her love for research started there. She won the top 2 clinical rotations at NYU and Mount Sinai. There were other rotations, but those 2 were the ones that she was the most proud of. She was a staff stenographer for several years, and then she started teaching physics and OB-GYN at Woonsocket Hospital. That is now a formal accredited program at Community College of Rhode Island. She was involved with research at Yale, then went on to become the program director there. She moved to South Carolina to care for her stepfather and worked at MUSC as a staff stenographer and worked her way up to a clinical instructor. She was also teaching physics at Trident Technical College. She left that to be CEO of Charleston Ultrasound Institute. CUI housed a clinic, a school of echo and vascular and research. After a few more jobs in various settings, she started as an applications specialist at Ultra Select Medical. At the time, she was only one of two apps ladies in South Carolina. Now she owns and operates Lisa Bachan Speaks, which involves public speaking, applications, classes, and research. She wants our listeners to know that she never stopped scanning a full load of daily patients until she went to USM. Please help me welcome Lisa Bachan. Please help me welcome Lisa Bachan.
Hi.
Thank you, Lisa, for coming on our podcast with us. Lisa, I got to know through a LinkedIn connection, and I thought we were talking about one topic, and we just ended up talking. So there's a lot of things that she has to share with us at different times that I think are really valuable to us as ultrasound technologists and people in the ultrasound world. And the first topic that really intrigued me with Lisa is that she did ultrasound for aesthetics. And so Lisa, start us off, first of all, just by telling us a little bit about yourself and how you got here into ultrasound. And then we'll start with what is aesthetics.
Okay. Well, the really short version is I started out to be a nurse, and that just really was not a good fit for my personality. So I tried to figure out what I was going to do for the rest of my life being a young person. And I stumbled across ultrasound, and I knew in an instant that was it. There were all sorts of bells and whistles that went off. I canceled the rest of my appointments, spent the day with the sonographer. So I was all excited, applied to all ultrasound schools, of which at that time there were very few, just to be rejected by all of them because I was a nurse, not an X-ray technologist. So I stopped nursing and went into X-ray technology, which I'm glad that I did. And then I went to ultrasound at NYU, and I have held every position within the field. I've been a staff sonographer, I've been a department head, I've been a program director of educational programs more than once. And lastly, an application specialist, which does include research and pioneering new things, new technologies, evaluating technologies to make them work correctly.
Awesome. Well, I know in our previous conversation, you talked about aesthetics, and that really kind of piqued my interest. So can you just start out by telling us what is aesthetics and how does that apply, or how does ultrasound really apply to that topic?
Okay. Aesthetics really grew out of two parts of ultrasound. One was head and neck medicine, which I did for 3 to 4 years in a very large multi-center clinic. And the other one is what we call POCUS, or point of care ultrasound. A lot of people that go into aesthetics in ultrasound, of which there are very few, they tend to specialize in musculoskeletal, where my background, while I have plenty of experience in musculoskeletal, I did head and neck. So what that is, we did invasive procedures, we mapped cancers, we followed things like Hashimoto's disease, any odd lump bump AVMs. I recently did a lecture in Boston, which my first shot was of an AVM, and the patient said to me, "What's this blue dot on my face?" And I said, "Oh, I don't know. Let's look and find out what it is." And it was a very small AVM, and they actually were able to ablate it and correct it, and the blue dot went away.
Mm-hmm.
So now we have aesthetics. Now, the field of aesthetics is synonymous with the beauty industry. So, what they do in the beauty industry is they treat skin condition. It is considered mostly cosmetic because you're working in an environment that does not take insurance. This is all cash pay.
Right.
Lip fillers, threads, cheek fillers, tear trough filler, marionette lines or smile lines in your face. Some people choose to augment their chin. If you've ever seen somebody with micronathia, it looks like their chin is kind of blending into their neck. Elderly women tend to get the turkey wobble, the wobble gobble.
Right.
Time for
Right.
giving. So there are various methods to treat that. Some doctors are dermatologists, while others are surgeons, and yet others are plastic surgeons. So it really does include a wide variety of specialties, but this is the first time that ultrasound has crossed the boundary. So how do we use ultrasound in this? Well, if you're going to stick a needle in somebody, you better be darn sure that you're not hitting a nerve, an artery, or a vein. If you're introducing a filler, you have to know exactly what that normal filler looks like. In addition to an infection, you have to know a lot about arterial occlusions and venous occlusions and how they present, because the medicine itself in this field is so different. You also have to make sure you don't hit a nerve. That has disasters. I've went to the conference in Boston. It was called Face It Live. And I was asked to be on the panel and discuss various aspects of ultrasound in aesthetics. And it was just amazing, the complications that you can have if you really don't know what you're doing.
Right.
It's always good to have your trusty ultrasound machine there to guide you, in placement, to guide you in terms of the facial anatomy, mapping the facial anatomy. Now, it doesn't only apply to the face. I mean, that tends to be the focus because we are so image oriented today and how we look and all of this. But there's any number of things you can work with. Keloids. Now, where I live, keloids is a really big problem because we have a large minority population, or what we'd say dark skinned or non-white population that forms keloids, and they're very painful and unsightly. So there's a lot of work being done in dissolving keloids. So that's important. There's certain scars that people may find unattractive, and how to lessen those scars. So it really goes beyond just the face. The other application of it is in breast reconstruction post breast cancer. So that's
Okay.
another really big opportunity there for the proper use of ultrasound in guiding those breast resections.
Wow. So how did you get into the field? How did
Because
you?
I did head and neck medicine.
Oh,
That
okay.
was the primary
Okay.
way. And then when I did application, I had a distributor call me and say, "Hey, Lisa, you're the only one that, might make sense of some of this. So can you please study it? And then I will send you out on speaking engagements, and I will send you applications to do." Because the other problem is that traditionally we do ultrasound in the dark.
Right.
Aesthetics doesn't do that.
Right.
Now, if you look at my face, I have 1, 2, 3, 4, 5, 6 lights on in this room.
Okay.
That's how they're scanning, with really, really bright light. So we had to do some really good testing, good clinical testing on how we can alter the presets, because they're all designed for either semi-lightly dark environments. So
Right.
if you're going to translate that into the field of aesthetics, you're not going to get an image.
Right.
So it's
Oh,
one of
that's it.
practice, 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 practice. And the first group in Charleston that had an ultrasound machine, they had me come probably every Friday for 6 to 8 hours. And we just worked and worked and worked and worked.
Wow. So you were kind of at the right place at the right time, right? To kind of pioneer that
Yeah.
new field, right? Because you kind of already became an expert in that area, right?
But it was also having done research and involved in research where I knew what had to be done.
Ah,
People didn't, there's a lot of people out there that say, "Oh, I'm going to sell into aesthetics," or "I'm just going to become an expert in aesthetic." Well, there's only 3 of us sonographers in the United States that are vetted experts in aesthetics and ultrasound, that use ultrasound. So it's not one of those things where, "Oh, I'm just going to learn where the masseter muscle is, and now I know everything about aesthetics." No, it's a lot deeper than that. There's a lot more science to it. And thank God I had that basis in head and neck medicine. But in my work with UltraSelect Medical, I was able to pioneer and join forces with Cycle Clarity. And they did work in the infertility market.
okay.
Done cardiac drug studies. So the captopril renal study, we did gallbladder treatment studies. Now, you may think, well, that's really not a lot, but research isn't over in 15 minutes. You don't scan a patient for 15 minutes and then you close out the study. Research does not work like that. So one study may last 3 years.
Right.
So the Cycle Clarity trial did last 3.5 years, which actually was very fast. And we got FDA approval, and Mindray, which is an ultrasound manufacturer,
Mhm.
had agreed to allow the software to change inside of their ultrasound machine, their DC-70 to be specific. And they got the FDA based on the work that I had done. And then Cycle Clarity got the FDA approval. We got them on the same day. And it was a very loud day, and the champagne corks were a popping. It was quite a celebration, but
So this may really kind of open up a new field for ultrasound techs then.
yes. Now, I'm not sure if your listenership is aware, but the SDMS has recently changed their scope of practice. And one of the significant things for us is now we can, with proper training, and I always emphasize that, put in IVs, run contrast. So what
Which
that
you've been able to do for quite some time in echo, right?
That's right. That's right. And usually it was a facility driven thing, whether you were or were not allowed to do that.
Oh, I see.
But because I had nursing training, I already knew how to do that. I already
Yeah.
background, so they felt fairly comfortable in allowing me to do those things. But now with proper training, that opens it up to non-nursing background sonographers. So then you have to go in, and it varies so much by state because each state has its own aesthetics regulatory board, and they oversee the educational offering that qualify them for the license in that state. So, if you're a thread injector, if you're a lip injector, if you inject other parts of the face, if you're doing dissolving, if you're treating vascular occlusions and things like that, you have to have proper training. Now, typically speaking, these clinics are now reputable ones. Let me back up and say that. There's a lot of non-reputable ones out there, but the reputable ones are either run by MDs and have MDs as medical director, or they're run by nurse practitioner or PA. So it's quite a degree of advanced education to really know your craft in that field. Because let's face it, you mess up somebody's face, they are really not going to be happy with you.
Right? I know someone who is a nurse anesthetist that has branched out and gotten her own practice.
Right.
So, you should feel safe with someone like that, right?
You should. Yes.
Yeah.
Yeah.
But still, it runs the risk,
Mhm.
And so having someone who is good in ultrasound, identifying those nerve bundles, right? And
Mhm.
yeah, because that's a whole different ball of wax, right? So you kind of
Right.
need that head and neck with the muscular skeletal understanding.
That's so true. I couldn't agree
So
more.
is there any training for this specific area of ultrasound?
Like I said, there's only 3 sonographers that train, but each one of us has a slightly different bent. The other lady that does this, she also on board aesthetics clinics. So she's talking about like the managerial aspect, the PACS systems, the connectivities, the EMRs, scheduling. Hers goes into more of the practice process side. She's a very good teacher. The gentleman that is in this, he likes to do pathology, but he will train you in your clinic on your system as far as the musculoskeletal aspect goes. My bent is the accuracy of your needle procedures, the functionality, the applications, the customization of your ultrasound machine. So, to hire a person to train, it depends on really what your needs are. Now, I don't only train in aesthetics. I train in cardiac and breast and abdomen, MSK, needle sticks, all sorts of things.
Right.
And my hope is always to have, and there's quite a lot of discussion here where I live, we like to get a fixed site training center so that, let's say you had a group that really needed some hands-on and you really needed to understand strain imaging. Well, we would put that together. You'd fly in, take the class, get your credits, and then you would apply that in your job site.
Okay.
But there's a lot that we could offer because there's so much now that is not offered in the standard sonography education that it's kind of a gap, if you will.
Right.
So the more you know, the more marketable you are.
Right.
The more marketable you are, the more job longevity you will have.
Right. Yeah. And yeah, like I've learned adult echo. And so it helps me understand the whole body in its entirety, not just OB. So learning vascular and adult echo really kind of opened my eyes to understanding a little bit more of the full picture, right? And then the nuances of high risk OB, right?
Right.
So yeah, learning new things and modalities are, I think, awesome. The one thing that learning adult echo did for me is I learned to scan with my left hand.
Yes.
So,
And that's exactly how I burned out my left hand and then had to go back to using my right.
Yeah. So every now and then when my right shoulder, like this morning, my right shoulder and hand and arm were just blistering, burning.
Yes.
And I thought, oh, I might have to switch to the left side today,
Yes.
and left-handed, which is not something that everybody can do, right? But I think that has kind of extended my years a little bit to be able to do that.
Yes.
So you never know what you're going to be able to use, but learning new and different modalities, I think, are always helpful.
Oh, yes, absolutely. I think the more you know, the more you realize how interconnected everything is. So if you have congestive heart failure, how does that affect your liver? How does veins in your leg?
Right.
One of my favorite stories to tell is a woman came in, a young woman, she was 23, and she came in for right upper quadrant. She had odd pain in her right upper quadrant, but I noticed that everything was a little bit lower than someone who's fairly thin that should be. So when I was scanning in the midline, I just flipped the probe up and noticed that she had a whopping pericardial effusion. I mean, bordering on tamponade. This was pretty serious. And I asked her, I said, do you get short of breath? Do you have chest pain? And oh, yes, I forgot to tell the doctor that. Again, talk to your patients. Because there's a lot that's not in the chart. And you might get 1 or 2 words of history, and there's a lot more to it than that.
Right.
So I actually flipped up and I looked at her ejection fraction. And because I could do an M mode, I could calculate the numbers out. It wouldn't auto calculate because I was still in the abdomen preset.
Right.
And her EF was not good. Her right side was dilated. I couldn't do a full echo with an abdomen probe, obviously, but I had enough information to say, hey, look, something is really, really wrong with this lady. So I took it into the radiologist. Long story short, I got written up and had a few demerits in my HR file because I was not supposed to do that. But I thought, am I the advocate for what the doctor wants, or am I the advocate for the patient? I'm the advocate for the patient. I want to save her life. I don't care about the radiologist hang-ups.
Yeah.
So I told her at that point, I called the ER and said, listen, I'm sending a patient down. And I explained what the problem was and that the radiologist was currently reading out the right upper quadrant, which incidentally was normal. And not too long of a stretch of time later, she got a heart transplant and she wrote me the nicest letter, and I copied it and I made sure that was in my human resource file.
Right? Yeah.
Yes.
I think it's important for aesthetics, that we do know, because when you're injecting, you have to be able to tell when it's in the wrong place, right? We're talking about fillers and things that will clot some pretty major arteries that are close or paralyze your face, right? Like I had some surgery to remove a growth, and part of my face is still a little bit numb from like 5 years ago, right? And so I can't imagine doing aesthetics without some guidance.
I can't. I don't know how they did it these several years without it. It boggles my mind, because we've got to have safety first.
Right.
And you can't just palpate a lip and say, oh, I know where your artery is. Let me inject over here, because that doesn't.
Right. Well, it's an interesting topic. It's something, like you said, that injection clause in the new scope of practice for advanced practice sonographers, and then, eventually the question will be, do we need to be registered in aesthetics, being that it's a whole separate field, right?
It is, with its own set of issues and appearances and research and all of that. I had spoken to the other 2 people who have, the 3 of us have kind of pioneered this field, along with a very select few of physicians. And I don't know. I think what they're going to try to do is maybe classify it under POCUS. But I wrote to POCUS and I said, well, what do you do with people who are already licensed sonographers? You're asking us to redo physics again? I had all these questions and I'm still waiting for an answer. I haven't gotten an answer on that yet. Either that or they're going to have to separate head and neck medicine to include aesthetics. I don't know how they're going to swing this.
Well, I'm still trying to get them to accept high risk OB as a specialty. So, and that's been around forever, right? So it does lots of time and specialty, but at least there's someone out there that other ultrasound techs or nurse practitioners or whoever's in aesthetics can reach out to possibly just send someone to you to get trained, or have you train them in a field, that is just probably getting off the ground for,
Yes.
I've certainly learned a lot about aesthetics with the person that I know, and it's fascinating, to see what is done and how it's done. And so thank you for your time and for sharing your expertise in this area and in this field. And we certainly can use it as another option for us. And it probably doesn't have near as much wear and tear on your body either.
Yes,
Necessarily.
right. You're right. Because you can vary the bed, vary how your patient lies, your patient's face or breast or whatever. That's a little bit more mobile. But one thing I do stress in all of my lectures is, protect your youth. Make sure you're using proper hand and upper body positioning to save. I always call it save your youth, because once it's gone, you cannot get it back.
Right. Well, thank you so much, Lisa. We appreciate your input in this field, and we will definitely put your email or link in the show notes. If someone wants to reach out and ask more questions or get to know more about this field, please feel free to contact Lisa, and we thank you very much.
You're very welcome. Thank you for having me.
Thank you for tuning in to It's All About the Frequency podcast. I hope you've enjoyed today's episode. Share it with a friend, and remember to keep your frequency high.